Let me start with something important. This video could genuinely save your cat's life. I'm not saying that for dramatic effect. I'm saying it because most cat owners don't know these signs, and by the time they do, it's sometimes too late to act. Cats are masters at hiding illness. It's not a quirk, it's survival. In the wild, a sick animal is a vulnerable animal. Predators target the weak. So over millions of years, cats evolved to mask pain, discomfort, and illness with extraordinary skill. They will act normal. They will eat a little, move a little, seem almost fine. This is why cat emergencies so often come out of nowhere. One day, everything seems okay. The next day, you're at an emergency vet, wondering how you missed it. You probably didn't miss it. Your cat hid it from you. That's what cats do. But there are signals, specific behaviors that break through the mask. Things your cat does when the situation has gone beyond what they can conceal. And if you know what to look for, if you catch these signs within the first 24 hours, the difference in outcome can be enormous. So let's go through them. Pay attention. Take notes if you need to. Cats are obligate nasal breathers. Under normal circumstances, a cat should never be breathing through their mouth. Never. Not after exercise, not in heat, not when stressed. If you see your cat breathing with their mouth open, even briefly, even just panting slightly, that is a medical emergency. Stop reading, stop everything, and get to a vet right now. Open mouth breathing in cats indicates feline asthma, heart failure, pleural effusion, fluid around the lungs, or a respiratory infection that has become critical. All of these conditions can become fatal within hours. By the time a cat is breathing through their mouth, their respiratory system is already severely compromised. If you see this right now, today, tonight, do not wait until morning. Emergency vet, immediately. Cats hide sometimes. That's normal. A cat that finds a cozy spot behind the sofa for an afternoon nap is just being a cat. But there's a different kind of hiding. When a cat is seriously ill, they withdraw completely. They find the darkest, most enclosed space they can, under the bed, inside a closet, behind the water heater. And they stay there. They don't come out for food. They don't come out when you call them. This behavior is ancient. When wild cats are dying, they go somewhere dark and quiet and alone. It is a deeply wired instinct. When you see your domestic cat doing the same thing, really doing it, not just napping, but gone in a way that feels wrong, your instinct that something is wrong is correct. Trust it. The rule is simple. If your cat has not come out to eat in more than 24 hours and is hiding in an unusual place, vet today, not tomorrow. Today. This one gets misread constantly. Owners see their cat avoiding the litter box and assume it's a behavioral problem. Stress, a dirty box, a preference issue. But sometimes a cat avoiding their litter box is screaming at you that something is physically wrong. Feline lower urinary tract disease, bladder blockages, kidney stones. The most dangerous version is a urinary blockage in male cats. A blocked cat cannot urinate at all. The toxins build up in the bloodstream. Within 24 to 48 hours, it becomes fatal. If your cat is going to their box more than usual, straining, crying, producing nothing, or showing blood in their urine, emergency vet. This is one of the most time-sensitive emergencies in feline medicine. Feline aortic thromboembolism occurs when a blood clot lodges at the base of the aorta, cutting off blood flow to the hind legs. It happens suddenly. One moment your cat is fine. The next, they are dragging their back legs, crying in pain, unable to stand properly. The legs may feel cold. The paw pads may turn bluish. This condition is most common in cats with underlying heart disease, which, remember, cats are very good at hiding. Many cats have heart conditions their owners don't know about. If you see your cat suddenly unable to use their hind legs, this is a genuine emergency. The outcome depends heavily on how quickly treatment begins. Every minute matters. Cats can be picky about food. They can go off a food they used to love. They can hold out for something better. This is normal cat behavior. But there is a line, and that line is 48 hours. A cat that has not eaten anything for 48 hours is at risk for hepatic lipidosis, fatty liver disease. When cats stop eating, their bodies begin mobilizing fat stores for energy, and that fat gets sent to the liver faster than the liver can process it. The liver starts to fail. The cruelest part, the longer a cat goes without eating, the worse they feel, which makes them even less likely to eat. a downward spiral that can be fatal within days. If your cat has not eaten in 48 hours, vet visit today. Not to panic, but to rule out underlying causes and get ahead of the liver issue before it compounds. A cat at rest should breathe slowly and easily, around 20 to 30 breaths per minute. If you watch your cat sleeping and their sides are heaving, something is wrong. Rapid resting respiration rate is one of the key indicators of heart failure in cats. It's also a sign of fluid in the chest, severe anemia, or pain severe enough that it affects breathing. Some vets recommend that cat owners learn to count their cat's resting respiratory rate as a baseline. Under 30 breaths per minute at rest is normal. Over 40 is a warning sign. Over 50 is an emergency. Count the breaths for 30 seconds and multiply by 2. That's your cat's respiratory rate. Know your cat's normal. Anything dramatically above it warrants a call to your vet at minimum. A cat having a seizure is one of the most frightening things an owner can witness. The involuntary muscle movements, the loss of consciousness, the confusion afterward. While a single brief seizure is not always immediately life-threatening, it is always a reason to see a vet within 24 hours without exception. Seizures in cats can be caused by epilepsy, toxin exposure, brain tumors, severe infections, hypoglycemia, kidney failure, or liver disease. You cannot tell which without veterinary assessment. If your cat has more than one seizure in 24 hours, or if a seizure lasts more than 2 to 3 minutes, that is a genuine emergency. Prolonged seizures can cause brain damage. After any seizure, keep your cat in a quiet, safe space. Note the time and duration, and call your vet immediately. Every cat has lazy days. This is not what I'm talking about. True pathological lethargy is different from normal cat relaxation, in a way that's hard to describe, but impossible to miss. The cat doesn't respond to stimuli they would normally respond to. They don't lift their head when you enter the room. They don't react to sounds. Their eyes may be partially closed. They feel heavier when you pick them up. They seem absent in a way that goes beyond sleepy. This level of lethargy can indicate severe infection, organ failure, extreme pain, or shock. If your cat is lethargic in a way that scares you, trust that feeling. You know your cat. If something feels profoundly wrong, it probably is. A cat that suddenly becomes aggressive, confused, or behaves in ways completely out of character may be experiencing neurological symptoms, severe pain, or a condition affecting the brain. Cats in significant pain often become aggressive, not because they want to hurt you, but because being touched when you're in pain is intolerable. If your normally gentle cat suddenly hisses, that's pain. Neurological symptoms, walking in circles, pressing their head against walls, sudden disorientation, are always a reason for immediate veterinary attention. Here's my ask. After watching this video, spend 5 minutes just observing your cat. Not playing with them, not feeding them, just watching. Watch how they breathe. Watch how they move. Watch their eyes. Note how they respond when you call their name or make a sound they normally react to. What you're doing is establishing a baseline. Because the hardest part of recognizing these emergencies is that we often don't notice gradual changes. If you know what your cat looks like when they're well, really know it, you will notice when something shifts. Your cat cannot call the vet. They cannot tell you something is wrong. You are their entire healthcare system. You are the one standing between them and an emergency that gets out of hand. The signs are there if you know how to look. Now you know how to look. Share this video with every cat owner you know, because one day it might be the reason someone's cat comes home from the vet instead of not coming home at all.